You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. According to my first guest, he said nobody should be wearing a loose-fitting denture. With us, we have an expert on this topic, Dr. Phillip Katz. Dr. Katz, welcome to the program.
Randy, thank you for having me. I appreciate it.
Now, you brought a lot of photos, so we'll try to get to as many of those as possible.
Okay, great.
Now, for people that don't know your practice, who's the typical patient that you see?
So in our practice, we actually have two different types of patients that come in.
Okay.
So the first patient they have no teeth. They've been wearing a denture their whole lives, or 20 years or 30 years, and they can't eat with it, and they've lived with it, and they don't know what the options are. So they come to see us because they know that there's a possibility where I can actually have my teeth back, a fixed set of teeth back, and I can do it in my office in one morning, not even a year like it used to be. We can actually do all this in one morning. We can sedate the patient, and they don't usually remember any of it. And when they're out of the sedation, they have a full set of teeth within a matter of a few hours. And that's it.
So when you say, and we've talked on the phone, that on the day of the procedure, they can walk in without teeth and walk out that day with teeth.
Absolutely.
That don't come in and out.
That's exactly
Is that
right.
Does that happen? It's rare?
It happens every day in our office. And we have, and the other type of patient that we have in our office is the patient who has lived with the broken down teeth for years. They've been told by their dentist that they need to have all their teeth out. So they don't want to, they have friends who've had horror stories with getting their teeth out, wearing dentures. They can't eat, they gag, they can't taste their food because of all the plastic. So they come to us because they know that there's another option rather than having to just live with their broken down teeth, living in pain, and they don't have to go into a denture. They can come to our office in a matter of one morning. We can take out their teeth, remove all the infection, clean out all the broken down teeth and all the roots, drop in some implants, and they wake up and they're perfectly fine. They're not in any more pain. They're not living in agony. They can taste their food. They can eat whatever they want. And it literally is life-changing. And that's what we do in our office on a daily basis.
And we should mention, the things we're talking about today, you actually teach other dentists from all over the country.
I do. I teach in California. I'm a faculty mentor at the California Implant Institute, where they teach dental implants to dentists all around the world. They teach this protocol, the all-on-4 protocol. They teach bone grafting. And I'm also a visiting faculty mentor at Spear Education in Scottsdale that teaches how to do complete rehabilitations to patients with all facts of life, to dentists all over the world. So I travel back and forth throughout the year. I take time away from my office to teach other doctors, which I actually enjoy doing. I love doing it. I've been doing it for years.
Now we should mention, I guess how the dental implant process is normally done is you go to one doctor that does the surgery.
Yep.
And then another dentist that puts the teeth on top.
Yep.
And then maybe somewhere else for the imaging. Now you have this concept where you do it all right there.
We do, and it's the technology has come so far forward over the last 10 years. We used to do it that way. I mean, I was trained as a general dentist 17 years ago. I was trained in surgery after that. And so the way it's done in most offices, and we get this on the phone from patients every day, they come to see us. The way we used to do it and the way it's done in most offices throughout the country, unfortunately, is they have to meet the dentist. Then the dentist will refer them to the surgeon for the implants. Then the dentist will then introduce them to the lab. And then they have to introduce them to the anesthesiologist. And then once that's done, they have to coordinate it. So they have to go from office to office to office to get all this work done. We have streamlined the process in our office, which has been incredibly amazing for our patients and incredibly successful. We do everything in our office. They come in to see me. I'm the dentist. I am the surgeon who's going to be placing the implants. We have the laboratory on site. We have the anesthesiologist on site. Everything is done here. You don't have to go anywhere. Everything is done here in one office.
Now you're doing like IV sedation. Some people are just taking a pill.
Yeah, we do IV sedation and we do oral sedation. So if somebody wants to be completely out with IV sedation, we have an anesthesiologist that comes in. Sometimes people want to just take a pill. We can give them the oral sedation. But I would say 99% of our patients would like to be sedated for it, and they don't remember anything after the procedure, which is nice.
We said at the top of the show, no more dentures.
Yes.
Are there a lot of people where you are? In Ohio with dentures, like an upper lower denture?
Yes. Well, in the country, there's probably, 30 million people that have dentures. In our area, we get calls every day. I'm guessing there's probably 30 to 40,000 people just in my immediate area that have no teeth. And the reason I know this is because we get hundreds of calls a month, interested in this procedure, and they don't know where to go.
So if the dental implants, getting new teeth with dental implants is so good, why aren't they all doing it? What's your take?
My take is they don't know what their options are. Most of these patients have been in a denture for so long, and they haven't been to the dentist in so many years. They don't know that this is even a possibility.
Okay.
I mean, then they see an advertisement, or they see me talking at one of my seminars, and then they know that, wait a minute, I can actually have teeth again, real teeth that don't come out, that I don't have to gag on my food anymore. And so they call us, and they don't believe us. So they call us, and they don't believe us. They call us on the phone, and we tell them, come on in, just give us a call, come on in. So when you're wearing a denture or false teeth, you don't know your options. You don't go to the dentist ever.
Okay.
Why would you go to the dentist? You know, you've lived with this for years, and you're just comfortable in just living the way you are. But how do they get into the denture? So there's the other patient that comes to see us that's interested in this. They used to have their teeth, and it was always breaking down. They would every other week they'd be at the dentist getting a tooth fixed, a broken tooth pulled, a root canal replaced. They're sick and tired of coming to the dentist.
Do you ever hear that, by the way? Like, no offense, doctor, but...
All the time. They come to see us, and they said, I am done with dentistry. I have spent thousands of dollars on my mouth. I don't want to do anything.
And they lost their teeth anyway.
And they've lost their teeth anyway, and I'm sick of it. I hate, no offense, doctor, I like you, I don't like the dentist, but I'm done with dentistry. I don't want to spend another dollar in my mouth.
Okay.
So they come to us, 'cause now there's another option available. We can do that for them.
To get their teeth back.
To get their teeth back.
How old can you be to do this?
Well, there's no age. Implants don't discriminate. So I've done implants on a 94-year-old.
Really? Why would a 94-year-old want to do this?
They want to eat, just like you do,
Okay,
just like I do.
That's fair.
I mean, who doesn't want to eat good foods? I mean, even when you're a little older, you want to enjoy life. People want to enjoy life, and I think it's fair. I think everybody should have this option of being able to eat whatever they want, not just the foods they can eat, which is what they tell me every day. They can only, they go to a restaurant and they open the menu and they look at the menu, and there's only 3 or 4 things that they can pick out of that whole menu that they can eat. I want people to come back and go to, after they're done getting their teeth restored, okay, with dental implants. They should be able to go out with their friends to a restaurant and be able to eat anything on that menu. Ribs, corn on the cob, apples.
Do they?
All the time. And that's the beauty.
Do they tell you eating stories?
They tell me eating stories all the time, Randy. I mean, I had a patient who told me the reason she came to see me was because she wanted to eat an apple again. That's it. She wanted to eat an apple, be able to taste the apple. She had dentures for years, over 20 years, top and bottom, couldn't keep them in. And the reason she wanted to come and see me, and she told me this, is because she wanted to feel that crisp, that bite when she got into an apple. So with her, with this absolutely wonderful lady, we gave her an upper set of teeth, a lower set of, these are fixed teeth. These do not come out.
Okay.
These are like real teeth. She can eat anything she wants. She can eat corn on the cob, she can eat nuts, she can eat anything she wants. She went home, she called us the next week, and we saw her for her post-op. She told me she had the best, crispest, juiciest apple she ever had in her entire life. And it changed her life. And you can see it in her face, in her eyes. It's a life-changing solution for patients. And they don't realize that it's out there. And I think the public deserves to know that this procedure is possible out there. I get it every day. Had they known that this was available many years ago, they would not have had their teeth taken out and the dentures placed.
Okay, so you've made dentures for people, though.
Many times, many times.
So let's just say they're flipping through channels, and then they see you, and you're the one that gave them their denture. What do you say to them?
I tell patients, I think dentures are not the standard of care anymore. I think the gold standard today are dental implants. I think everybody deserves the opportunity to know that dental implants are the way to go and should be the first option. No, look, Randy, nobody wants to wear a denture. Who wants to have a set of plastic in your mouth that gags you, you can't taste your food, that you have to learn to keep down with your tongue, that I have a patient. Can I talk about another patient here? I have another patient. She teaches patients, other health professionals, how to do CPR. Okay. And so she came to see us. She had an upper denture. She can't wear it, and she can't perform her daily tasks. It's holding her back. Okay, and her job. She can't give CPR on her dummy patients because whenever she does, she blows out the teeth. I mean, it blows out of her mouth.
Yeah,
she can't keep them in, so she can't do her job. She came in to see us in one morning. We took the denture out. We slipped him some implants. She had them all locked in there. They're real teeth. They look gorgeous on her.
Okay.
She can perform her job now. She can go in there. Nobody knows that she had this done. She looks completely amazing. A friend of hers told us that they thought she had a facelift. They didn't know what happened. It looked that amazing. But she can now she told me she can give CPR and she could do her daily job, and now it's not holding her back anymore. That's stories that we see on a daily basis.
Okay,
in our
good.
office.
Now you brought photos. What are we looking at?
I did. So this gal came to one of our implant public seminars, and she has just an amazing personality, very outspoken, very outgoing, just an amazing person. She came to us because she wanted to eat ribs again. She couldn't eat ribs. That was what she told us.
All right.
She wants to be able to eat ribs again. And if you look at it, her teeth, that's an aging smile. You can look, the teeth are kind of broken down in the front. She couldn't eat foods that she wanted to eat. Ribs, hard foods, sandwiches, chicken, raw vegetables. And so what were their options? Well, she was told the only options she can get are dentures. And so she came to our seminar, and I informed her that implants are an option. Okay. And so in one visit, instead of giving her the denture that everybody had told her that was the only option that she had available, in one morning, we were able to slip those teeth out, drop in some implants, and then we were able to give her a brand new set of teeth. And you can see in the before and afters.
Okay, let's take a look.
Okay. In the before and afters, you can see she's not used to smiling, as you can tell. And that second photo was only taken a week later. And you can tell she's still learning how to smile. When people
learning how to smile?
Learning how to smile. When people are hiding their teeth for so many years, they actually start to cover their mouth, and they actually smile with their lips closed together. And they actually train themselves, and we help them. We try to. We make jokes somehow. We try to get them to learn to smile again. That's the hardest thing. You can see her smile. She's starting to learn to smile, but you can see her whole life is different. She can eat what she wants. Just look at her eyes. It's all in the eyes, Randy. I mean, if you look at her whole personality, it has changed. She came to us wanting to be able to eat again, and she could eat anything she wants. Randy, would you say that she looks younger in the after? Don't you think she looks younger?
You know, that's a good point. Yeah, she definitely looks younger.
She does, and that's typical. When you get something like this done, just like that patient I had talked about earlier, people think they had a facelift done. They look younger. They look 10 years younger. And most
you're a dentist. So
Yes.
Of course you probably think that teeth are the most important thing.
We do, but most of the public doesn't. When you restore someone's smile and give them back their teeth again, the public doesn't see that. They see their whole face has changed, their whole body has changed, their whole personality has changed. It's not the teeth. Most people don't know that she had this procedure done. Most people don't know it. Maybe, oh, did you do something with your hair? Did you lose weight? What's different about you? Your eyes look different. No, it's just by giving her teeth, she's able to smile bigger. Her whole life, her personality has changed. So you can see the difference. That is a typical patient that comes to see us. So back to your statement, Randy, about I'm just a dentist and the smile is important. Okay, the smile is important to everybody. Okay. Employers looking to hire people. Okay, so you have somebody who covers their smile, hides their smile. You barely see them smile. They're embarrassed. And then you get somebody else who comes in, their smile is beaming. They're excited to be there, and you can just see it in their face, in their eyes.
All right.
Which one would you hire? I mean, would you hire somebody who's quiet and subdued and they don't like to smile, or you could hire the outgoing, outspoken person?
Yeah, the self-confident.
The self-confident person who can smile.
That's a good point.
And that's typical. You know, it's kind of like in Hollywood. You know, if you're gonna make somebody look bad, what do? You take out one of their front teeth. Okay, right. They look like the villain. Now they do. They look like the bad guy, or the poor guy, or the homeless guy. That's what they do. You know, or the pirate. That's what they do. So
people with bad teeth are discriminated against.
They're discriminated
or
against. Yeah, absolutely, they're discriminated against. When you give somebody back their smile, forget their chewing. That's a side effect. When you give them back their smile, their whole life changes.
Okay.
They get the job. They can go out with their friends in public. They can go out to the restaurants and eat again. They're not afraid to stay in. I have patients that won't go out for holidays. They won't go out for Thanksgiving.
Really?
For birthdays.
Just because of their teeth?
Because of their teeth. Because they're afraid that when they go out and everybody's eating chicken wings, they have to go ahead and order mashed potatoes and something soft. And they can't eat those wings because they're afraid that their teeth are either going to break or their dentures are going to fall out. And that is a typical patient that we see in our office.
So you brought more photos. What else are we looking at?
Yeah. So this gentleman, incredibly nice guy. He came to us with missing teeth, broken down teeth. He had cavities. He was told there's no options for him. He said he will never wear a denture. He has heard horror stories about it. He is a very outspoken, very, very fun guy, and he has a very big social life, and he wants to go out, and there's no way on earth he'd wear a denture. He's not going to have that fall out when he's out with his friends and his wife and his families. Okay, so Randy, here's what we did for him, and this is incredible, because he came to see us because he did not want a denture. In one morning, we start at 7 o'clock. By the time 11 o'clock, 12 o'clock, we were able to remove the bad teeth, remove all the infection, clean everything up, drop in 4 implants, gave him fixed teeth that morning.
A full set of teeth.
A full set of teeth that morning, locked in, no palate, no plastic on the roof of his mouth, doesn't remember anything because he decided he wanted to be sedated for this. And
let's take a look. Let me take a look at that photo. Oh, wow.
Yeah, and he's coming back next year to do his lowers. He's phasing it out. Some people decide to do it that way. He wanted to do his uppers now, and he's able to eat whatever he wants. No cavities, no infection anymore. That should last him the rest of his life. Look at the before and after side by side. Just look at the difference. Look at his eyes. I mean,
he's more handsome.
He's more handsome.
Yeah.
He didn't
I'm
know
not
how
trying
to
to side with you, but he does look better.
He did not know how to smile. Look at the smile beforehand. He kept his lips closed. Look at how bigger his smile is now. It's twice as big. He's excited to have the teeth now.
Now, can they bite into like a carrot or something
they can
with their
bite
front teeth?
Anything they want.
Like
they
a hard thing? It doesn't matter?
Nuts. They can chew ice. I tell them not to. I don't recommend it. But they can chew nuts, corn on the cob, apples, raw vegetables. To me, everyone wants to eat corn on the cob, but it's the raw vegetables that people can eat. Salads. They can't eat salads. I have patients that they haven't eaten a salad in 15 years because of their teeth. A salad. And so people who have bad teeth, they live on starchy foods. And so they develop diabetes, they get overweight, who wants to eat scrambled eggs and mashed potatoes every day? You want to eat chicken and raw vegetables, and you got to get your protein levels up. And so people who get their lives changed like this can eat anything they want. It's just like having real teeth.
We should mention this. Medicare, Medicaid does not cover this at all. And even with the best insurance, covers just a small portion.
That's correct. However, most patients finance this, just like when you buy a car or you buy anything. You finance it. So
people are financing this.
Most of our patients finance this. 99% of our patients will decide what is their comfortable monthly payment that they can do. That's how you get stuff like this done. That's how you buy anything in life. You finance this. So anybody can get something like this done. I have a great office manager who, that's all she does is figure out ways for patients to afford something like this and get you financed for something like this.
Okay, good. And you will work with their insurance?
Absolutely. And if their insurance covers stuff, maybe the extractions, absolutely. We'll maximize their benefits every year. Okay. And whatever it doesn't, we'll finance the rest. That's perfectly fine. It works great. And that's how patients are able to get this done. We do this every day in our office. And people are finding a way to get this done because they don't want to live the life that they've been living for the last 15 or 20 years.
So nobody should be wearing dentures?
Nobody should be wearing. It should not be the standard of care. Implants.
They should all be attached to something.
They should be locked in. Why would you not want, if that's possible, why is dentures still in some places still considered the gold standard? Patients hate dentures. I get it.
I know a couple of denture wearers. They never complain to me.
They're not going to complain to you because you're not a dentist. They're going to complain to me. Okay. They come into my office every day. They can't wear their teeth. They keep it private, and most people their spouses don't even know they wear dentures. They hide it. They're afraid that their spouse is going to find out they wear dentures. They tell me they go into the bathroom, take their dentures out to clean them, they lock the door, and then they put them back in. Some spouses don't even know they have them at all.
Really?
Yes. And so they come to see us because they don't want to live that life. Who deserves to live that life where they're hiding from their spouse the fact that they have false teeth?
You're excited about this, by the way.
I love it.
I mean, I'm picking up on it.
Yes, I love it. It's life-changing. It's fun to do fillings, it's fun to do root canals and crowns, but when you change somebody's life like this, and you see the before and afters, and you see when they're sedated and they wake up and you give them a mirror and then you see the tears come out of their eyes, and their face is completely different. Of course you're going to be happy as a dentist. I didn't get into this knowing the impact that this would have on people's lives, but when you see how their lives are completely different. 180 degrees different.
Now they send you cards and...
I get cards, I get
letters. I read one of your letters.
Yes, we get letters, we get video testimonials. Just yesterday, I had a patient come in for a follow-up visit. We gave her a full set of teeth on the lower. She came over to me. I hadn't seen her. My assistant had seen her. And then she came back. She came around the corner. She said, Dr. Katz, I have to talk to you. She came over to me and gave me a hug. And she said, for the first time in my life, I was able to eat popcorn, nuts, and pizza. And I have not been able to eat that my entire life since I've had dentures, and you've changed my life. And stories like that is why we do this. So let me show you another patient here, okay? So she came into me with her lower teeth completely broken down. She could not eat the food she wanted. Cavities on them, she had a whole bunch of missing back ones there. And this is how she smiles, Randy. You can see she hardly smiles. She doesn't show her teeth at all. She's afraid. She's done that for years and years. And she doesn't know how to smile. You can see kind of a little depression in her eyes a little bit, maybe a little sadness in her eyes. That's a typical patient. They don't know what smiling is like. So her options were either, a denture that slips and moves around in the mouth, or get her teeth back, full function, and she can eat anything she wants. She decided to get full teeth, okay? Here's her after. Look at the difference. Just look at the difference. She has a full smile now. Now she's showing all of her teeth. She could eat anything she wants. She came to us not knowing those possibilities. She heard that we do public information seminars to the public.
So she probably showed up? She showed up
to our seminar, and she heard me educate the public and teach the public what implants are. She was interested, made a consultation with our office. I sat down with her one-on-one. I told her that she was a candidate for this, that we can do it all in one visit, one morning. She scheduled the procedure. We got that, and just look at the difference. Look at her eyes.
Now we should mention too, people need to know that I'm not siding with you. I'm just asking the questions, but it's not always done this way, this one-day approach.
That's right.
This comes from like additional training.
This is it's extensive training. It's years of training. So the way it's done in most offices, again, they will take the teeth out, give them the denture. Okay, they wear the denture 4 to 6 months. They go back in, do bone grafting, which costs a lot of money. They wait another 4 to 6 months. Then they go and have the implants placed. They wear the denture another 4 to 6 months. Then they get their teeth. So then there's nothing wrong with that. That's still the way it's done in most offices. But who wants to wear a denture for 2 years? I mean, we could do something in 4 hours that used to take 2 years. Time is of an issue for everybody. People want immediate gratification today.
Especially nobody wants to go back and forth.
Nobody. Who wants to go to the day? Who wants to have, first off, who wants to have 5 surgeries? Nobody wants to have 5 surgeries. Who wants to be sedated 5 times? And who wants to see 4 doctors to do all this? Okay, we do everything in 4 hours in our office. You come in at 8 o'clock.
Approximately 4 hours.
Approximately 4 hours. Sometimes it takes 3, sometimes it takes 5 or 6. A morning, I'll say in a morning. They come in the morning, by the early afternoon, they're done. They wake up with teeth. Okay, sometimes they're not even sedated. They don't usually remember any of the stuff. They're completely numb. Our typical patient, all they need after something like this, we give Tylenol and an antibiotic. That's it.
How soon can they eat?
They can eat right away. So while you got to understand something. The teeth are locked in. Okay, they have to have a softer diet for a while. Okay, until it locks in fully. Okay, but there's no denture. There's no plastic at all. And
within a couple of weeks, they're eating and chewing
eating
whatever
anything they want. And as the months progress, they can eat as hard of foods as they want. When that fully takes, they can eat nuts. They can eat corn on the cob, raw vegetables, chicken, ribs, anything they want. And I'm telling you, it's life-changing. That's why they see us. So here's another photo, if you don't mind.
All right.
She's another patient that came to see us. Her husband, we had placed some new teeth on his upper, and he was so thrilled about it. Her husband was so thrilled with having his new teeth in there. We did what we did for him, we did for her. In her case, we took the denture out in one morning. We sedated her so she doesn't remember anything about it. Now, just so you know, some people do remember the procedure, but they don't usually feel anything because they're completely anesthetized during this. But
with the IV sedation,
or the oral sedation, it's cloudy. It's twilight. It's getting their twilight, and so it doesn't bother them. They hardly remember a whole lot. They wake up with new teeth. The denture's gone.
She looks happy in that.
She's thrilled. She can smile again. She can eat again. She doesn't have all that plastic in the roof of her mouth. She can taste her food again, because people don't realize that there are some taste buds on the roof of the mouth, and if you cover the roof of the mouth, you can't taste your food. Okay, and there's no plastic in that. That's locked in there. She's done. Randy, do I have time for a couple more photos, please?
We got only about 2 minutes left.
Okay. I'm going to go through these real quick. Okay, so this patient came into me. She came into me with her tooth broken off at the gum line. She had told me her whole life she had broken down teeth. Those teeth could not be saved. Okay, none of those teeth, the top or the bottom. In one visit, we were able to give her a set of upper teeth, locked them in. She came back, we did her lower teeth. Look at the difference. Just
Nice.
look at her smile. It's her whole personality has changed. She's thrilled. She can eat anything she wants. She can smile, and you can just see the difference. Her whole face looks different, and it's all in the eyes. Here's another patient. Let me show you this. This patient came to me. Her whole life was cavity. One cavity after the other. Broken down tooth, broken down root canal, couldn't stand it, had spent a fortune on her mouth, okay? And she did not want a denture, just so you know, okay? That was her only option. All those teeth needed to come out. She would not wear a denture. In one visit, I told her we can take the teeth out, we can slip the implants in there, and she can have a full set of fixed teeth.
Those look real right there.
She can eat anything she wants. There's no more cavities. Implants don't get cavities. They last you a lifetime. The studies show 98% success rate over 10 years. It's amazing. That will be there pretty much the rest of her life, as long as she maintains it.
So that smile right there, it's made of this
It's made out of zirconium, which is the strongest material in all of dentistry. You can eat anything you want. Knock on wood, I haven't had one break yet. I'm sure if they bite into ice cubes, I'm sure it can. You can eat anything you want with that. She was not able to eat anything beforehand. Look at the difference. Just look at her. Look at her whole face. She looks completely different. You know, let me show you these last two patients, if you don't mind.
Okay.
This gentleman, super nice gentleman, would not smile. He came to me, you can see his smile. He had broken down teeth, worn down teeth, could not save any of his teeth. Couldn't save any of his upper teeth at all, or his lower teeth. What we did in one visit, we slipped the teeth out, dropped the implants in one morning, okay? We sedated him as well. He woke up with brand new teeth. His wife is thrilled. He didn't take any medications. He came to see us after it was done. We had given him the Tylenol, the Advil, and antibiotic. Didn't need any of it. Okay, that's a rarity.
Wow.
Most of the time they need some. He was great. I think he mowed his lawn the next day or the next couple days. He was perfectly fine. Okay, let me show you my last patient. So she came to me wearing this denture. She could not wear the denture. This is the patient that could not eat hard foods at all. Her goal was to be able to eat an apple again. This is the one I was talking about earlier.
Okay.
She said the reason she came to me is because she wanted to be able to eat an apple, a crisp apple. After we were able to place the upper teeth and lower teeth locked in, I think we placed 5 implants on the upper, 6 on the lower for her. She told me, she came back, she said, I had the best apple I ever had in my life. It was life-changing for me. That's all I wanted to do. But her whole life is different. Just look at the difference. She's thrilled, and she wrote us the most beautiful testimonial.
Yeah, I saw this.
Yeah,
she goes on to say you changed her life, and
yeah, and she's just one of the most amazing patients. But that's a typical patient. Okay, we see patients like her on a daily basis, life-changing.
So no more dentures.
No more dentures. People deserve to have real teeth that they could eat anything they want with.
Okay, good. Final message. Somebody watching this, maybe they even been to your public seminar, but they're still afraid or skeptical.
Yeah.
What do you say to them?
I tell them, please, whatever you've heard in the past, you've been told you cannot have this procedure, you don't have enough bone, whatever, give our office a call. We can get you in one visit. I can tell you whether or not you're a candidate. We'll take a 3D CT scan on you. I'll sit down with you one-on-one.
Is this a free consultation?
It's a free consultation. We don't charge. I think everybody deserves to know their options. Then they can make an informed decision. Give our office a call. We see patients every day, just like you guys, and we will find a solution for you. I promise you that.
All right, I want to thank you so much for coming on the show.
Thank you very much.
Interesting.
Appreciate it.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you could help.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.